Assalamu alaikum, students. Today we will discuss some of the important MCQs regarding the anatomy of the breast. So it's very important from exam point of view, and rarely the clinical scenarios are discussed, as it is more frequent nowadays that the clinical scenarios are included in the paper of first year MBBS and second year MBBS exams and other disciplines also. So, starting from the scenario number one, a 42-year-old woman presents with a lump in the upper outer quadrant of her left breast. She is worried because her mother was diagnosed with breast cancer. On examination, the lump is mobile and non tender. Which structure is most likely to be involved in the lymphatic drainage of this region? Now, the important point in this is the upper outer quadrant. And he have asked about the lymphatic drainage of that region. Okay, so the answers are parasternal nodes, anterior axillary nodes, apical axillary nodes, central axillary nodes, supraclavicular nodes. So the correct answer is the anterior axillary or pectoral nodes. So lymph from the upper outer quadrant mostly goes first to the anterior axillary lymph nodes. So second question, a 35-year-old woman undergoes a radical mastectomy for breast cancer. After surgery, she notices weakness in adduction and medial rotation of the arm. So, which nerve is most likely to be injured? So, adduction and medial rotation of the arm is produced by which muscle? So, this is produced by the latissimus dorsi muscle, which is responsible for the adduction and medial rotation of the arm. And thoracodorsal nerve can be damaged in this process. Another nerve which can be damaged is the long thoracic nerve, which supplies the serratus anterior. And often, a patient with radical mastectomy, they complain of that they are unable uh, to raise the arm above the 90-degree for movements like combing or wearing clothes. So, third question, a 28-year-old woman presents with pain and swelling in the right breast during lactation. She is diagnosed with acute mastitis. Now, this is a different scenario presenting with an infection in the breast, acute mastitis. Which anatomical structure responsible for storage of milk is likely to be inflamed? So, alveoli is inflamed, lactiferous ducts are inflamed, lactiferous sinuses are inflamed, suspensory ligament of Cooper is inflamed, or annular glands. So these are the lactiferous sinuses that are the dilated portions of the lactiferous ducts just before they open into the nipple where, where the milk stored. So these structures often become inflamed during lactation. Now, a 50-year-old woman presents with skin dimpling in the lower inner quadrant of her right breast. On further investigation, she was found to have malignancy involving the fibrous tissue of the breast. Which structure is responsible for the appearance of skin dimpling in this case? Now, is this the glandular tissue or the lactiferous ducts, pec major muscle, suspensory ligament of Cooper, or the subcutaneous fat? So, it is the suspensory ligament of Cooper. Now, you know that the suspensory ligament of Cooper attaches the breast dermis to the underlying fascia. So these ligaments are like that. So they maintain the shape of the breast. So these structures, when they are involved in the carcinoma, they cause dimpling in the skin because they retract the skin. Question number 5. During routine physical examination, 45-year-old woman is found to have an enlarged mass near the medial side of the left breast. Which structure is most likely to involve in lymphatic spread of this tumor? Axillary lymph nodes, parasternal nodes, central axillary lymph nodes, apical nodes, or the posterior intercostal nodes. So the answer is the parasternal nodes. So I hope now you can better attempt the questions regarding the anatomy of the breast. Thank you.